Welcome back to another deep dive. Okay, let's unpack this. Today we're tackling something truly universal, something that touches all of us yet often goes unseen: ageism.
It really does.
Our mission today is, well, to cut through the noise. We want to give you the clearest, most actionable insights from a whole lot of research, everything from global health reports to some really deep academic papers.
Yeah, there's a lot out there.
Exactly. So you should walk away not just informed, but really ready to understand ageism, its profound impact on, mental and physical well-being, and most importantly, the powerful research-backed strategies available to combat it.
And what's truly striking here is just how deeply ageism is woven into our world,
Yeah.
often flying completely under the radar despite its significant global reach.
Right.
And like you said, this isn't just about older individuals. It's a bias that impacts everyone, really, at every stage of life.
Everyone.
The research reveals a pretty shocking prevalence. At least 1 in 2 people globally hold ageist attitudes.
1 and 2.
And get this, in a large 2022 survey, a staggering 93% of U.S. adults aged 50 to 80 reported regularly experiencing some form of everyday ageism.
93%, that number is. It's truly startling.
It is.
It makes you wonder, if it's that pervasive, how much is conscious bias versus something almost built into our societal fabric that people don't even recognize?
That's a great question.
So let's get to the core of it. What exactly is ageism? It's far more than just discriminating against older people, isn't it?
Absolutely. The World Health Organization defines it based on 3 things. Stereotypes, that's how we think, prejudice, how we feel, and discrimination, how we act, all directed at people based purely on their age.
Okay. Stereotypes, prejudice, discrimination. Got it.
And it's systemic prejudice, just like racism or sexism. In fact, the gerontologist Robert Butler, who coined the term over 50 years ago, drew that direct parallel. He wanted to underscore how deep-rooted it is.
That parallel is powerful. It really frames it differently.
It does. And he touched on something important, how ingrained it is. That's why it shows up at several distinct and often subtle levels.
Okay, so what are those levels?
Well, first we have institutional or structural ageism. This is the stuff embedded in policies, social norms, the system itself. Think about mandatory retirement ages. The research shows these often push capable people out of work prematurely. Or consider clinical trials. 30% in leading medical journals had an upper age limit without any scientific reason.
So older people just get excluded from research.
Effectively, yeah, excluding them from potentially life-saving treatments or understanding how things affect them. Even how governments define prime working age, often 25 to 54, that shapes labor policies in ways that can sideline older workers.
Huh. I never thought about that prime working age definition having that effect.
It's subtle, right? Then there's interpersonal ageism. This is about those everyday interactions.
The face-to-face stuff.
Exactly. It can be things like elder speak, that patronizing tone, talking down, oversimplifying, or even just speaking really loudly to someone who doesn't have a hearing issue.
Oh, I think I've seen that. Like a cashier talking super slowly to an older customer.
Precisely. It's often unconscious, maybe well-meaning, but it can feel incredibly demeaning. It also includes dismissive jokes like, "Okay, boomer," or how media often caricatures aging as only negative, frail, burdensome.
Yeah, the media portrayal is a big one.
It is. And finally, perhaps the most damaging, is self-directed ageism.
Meaning turned inwards.
Exactly. This is when individuals internalize those societal ageist beliefs. They might start actually believing they are too old for a promotion or dismiss forgetting something as just a senior moment instead of, something anyone might do.
Or thinking symptoms are just normal aging.
Right. Avoiding seeking medical care because they assume, oh, this pain, this fatigue, it's just part of getting old.
That sounds dangerous.
It really can be. And what happens is this kind of self-perpetuating cycle. Societal ageism leads to internalized ageism, which then can lead to behaviors that seem to confirm the stereotype, reinforcing the prejudice all over again.
A vicious cycle.
And it's crucial to remember, ageism isn't just about older adults. Younger people face stereotypes too, being seen as lazy, unreliable, and that leads to discrimination, especially in the workplace.
That distinction between the 3 levels, institutional, interpersonal, self-directed, it really highlights how comprehensive this problem is.
It covers a lot of ground.
And it's not just comprehensive in its forms, but also in its consequences, right? Let's talk about the tangible impact,
Yeah.
because this isn't just about, hurtful words or feelings. The research shows it creates genuinely concrete challenges,
Yeah.
big barriers in people's lives.
Oh, absolutely. The research really paints a vivid picture here. Take healthcare, for instance. Ageist biases can lead straight to inadequate care.
How so?
Well, providers might dismiss treatable symptoms as just normal aging, or they might assume depression or pain are just expected in old age.
So people get undertreated.
Undertreated, or sometimes even overtreated based on assumptions. And this discourages older adults from seeking care in the first place, which means delayed diagnoses, preventable complications.
And that must have a cost.
A huge one. One study estimated that ageism in healthcare led to about $63 billion in excess health costs in just 1 year in the U.S., just from conditions getting worse than they needed to.
63 billion. Wow.
And even the communication itself can be ageist doctors, over-talking, interrupting, directing questions to a caregiver instead of directly to the patient.
Making the person feel invisible.
Exactly. Then look at the workplace and economic bias. The numbers are pretty stark. Most people over 40 report experiencing or witnessing age discrimination.
Most people.
Yeah, stereotypes about older workers being less adaptable, not good with tech. They're widespread. And they have real effects.
Like finding a job.
Definitely. One study highlighted how a 50-year-old could be 3 times less likely to even get an interview compared to a 28-year-old with similar qualifications.
3 times less likely.
It leads to being overlooked for training, for promotions, feeling pressured into retiring early. And the financial hit can be huge. Over half of those in their 50s pushed out of stable jobs find it really hard to recover financially. Only about 10% ever do.
That's devastating for long-term security.
It is, and the cost to the economy. Estimated $850 billion in lost productivity in the U.S. in 2018 alone.
850 billion. That's
Yeah.
massive.
And remember, ageism doesn't exist in a vacuum. It often intersects with gender and racial biases, meaning older women and people of color can face even longer stretches of unemployment.
So it compounds the problem.
Right. And it's this strange paradox. We hear about millions of unfilled jobs, yet we have this whole group of experienced, willing older workers who are being excluded.
That doesn't make any sense.
It doesn't. Beyond work and health, there's social exclusion and stereotyping. Those negative media portrayals we mentioned, frail, burdensome, they lead to marginalization, people feeling like they don't belong.
We saw some of that during the pandemic, didn't we?
We really did. Some of the public discussion almost framed older lives as less valuable, which caused terrible isolation for many seniors.
And that connects back to the self-directed ageism you mentioned earlier.
Exactly, the internalized ageist beliefs. When older adults take in these negative stereotypes, it really undermines their self-esteem, their sense of agency. They might avoid getting help, assuming problems are just inevitable.
You mentioned a Yale study.
Yes, fascinating stuff. It found that older individuals who held positive attitudes toward aging had almost a 50% lower risk of developing dementia over 4 years compared to those with negative views.
50% lower risk of dementia just based on attitude.
It strongly suggests that internalized ageism isn't just psychological. It might actually contribute physically to cognitive decline.
That link between mindset and something like dementia risk is truly eye-opening. Does that mean the scientific community is looking more at psychological approaches for things we thought were purely physical?
I think there's definitely a growing understanding of that mind-body connection, yes.
Because the research seems to draw some very clear and frankly concerning links between ageism and our mental well-being. What are the key ways it impacts our minds?
Well, the mental health consequences are profound, as the research shows. There's a really strong link between experiencing ageism and the onset or worsening of depressive symptoms over time.
A direct link to depression.
Yes. A huge systematic review looking at over 400 studies found that in nearly 3/4 of cases where ageism and health were linked, mental health was consistently worsened by ageism. The WHO even estimates something like 6 million cases of depression worldwide might be a direct result of it.
6 million. That's incredible.
It is. And anxiety is another major piece. Those negative stereotypes create a lot of stress and worry about aging. There's something called stereotype threat.
Stereotype threat.
Yeah, it's that fear you might confirm a negative stereotype about your age group. Like if you're older and worried about seeming forgetful, that very anxiety can actually impair your memory performance. It's a nasty feedback loop.
Wow. So the fear makes it worse.
Exactly. Ageist messages, social exclusion, they significantly increase anxiety. And the research notes that ageism and loneliness often work together, sort of holistically affecting mental health, fueling both anxiety and depression.
Which leads to loneliness itself, I imagine.
Absolutely. That feeling of being dismissed, written off because of your age, it often causes people to withdraw socially. So ageism is clearly associated with lower quality of life, greater social isolation, and loneliness.
And that must impact self-worth.
Deeply. It can create what researchers call a thwarted sense of belonging, feelings of being a burden. And tragically, this can increase the risk of suicidal ideation, particularly the data shows in older men.
That's incredibly serious.
It is. And underneath all this, there are psychological mechanisms at play. We talked about the internalization of stereotypes, their stereotype threat, and another model, the Vigilance and Everett model, suggests that the constant stress of just battling age-related biases, always being on guard, generates heightened anxiety because your self-worth feels constantly under attack.
It sounds exhausting.
It really does. And it's not just mental. There are physical and physiological impacts, too. Ageism is causally linked to earlier death.
Wait, causally linked?
Yes. People with less positive self-perceptions of aging, basically, more internalized ageism, live, on average, 7.5 years less than those with more positive views.
7.5 years, just based on how they view aging.
That's what the longitudinal research indicates. It can also lead to poorer overall health outcomes, more chronic conditions, slower recovery from illnesses. It really permeates everything.
Okay, so it's clear ageism is a serious public health issue. It impacts our lives in just so many profound ways. But the good news, as you mentioned, is that it's modifiable.
That's the crucial takeaway. It is absolutely modifiable.
So let's turn our attention to what can actually be done. The research points to effective strategies, multi-level interventions that can really make a difference. What does that look like in practice?
Well, the evidence gives us some clear pathways forward, and it is definitely a hopeful outlook. One of the most proven methods involves education and intergenerational contact programs.
Education and bringing different generations together.
Exactly. A big meta-analysis looking at 63 different studies showed significant improvements in attitudes and knowledge about aging, especially when education is combined with direct, positive contact between generations.
Can you give an example?
Sure. Imagine a program where medical students don't just learn about older patients, but they actually mentor older adults, maybe hear their life stories. Research shows these interactions actively break down the students' biases. They become better doctors.
That makes sense. Building empathy.
Precisely. Or think about middle schoolers working with seniors on a local history project. They realize the wisdom and experience available. These kinds of initiatives directly challenge stereotypes. The WHO actually calls them low-cost, high-impact interventions.
Low-cost, high-impact. That's what we like to hear. What about on the individual level?
Great question. We need therapeutic and psychological interventions for older adults. First, we have to tackle what's sometimes called therapeutic nihilism, the really outdated, harmful belief that older adults are somehow beyond help or can't benefit from therapy.
Which isn't true at all.
Not at all. Modalities like cognitive behavioral therapy, CBT, are highly effective for depression and anxiety in older adults. Therapists adapt it, maybe using simpler language, repetition, visual aids.
What kind of techniques?
Things like cognitive restructuring, actively challenging those internalized ageist beliefs like, I'm useless now, or behavioral activation, encouraging engagement in meaningful activities again. Sometimes using life timelines helps people reflect on their accumulated wisdom and resilience.
Reinforcing the positives.
Exactly. Another promising therapy is acceptance and commitment therapy, or ACT. There are programs specifically designed, like one called Reimagine Aging, which has shown success in reducing internalized ageism.
How does ACT work in this context?
It focuses on building psychological flexibility using mindfulness and something called attributional retraining. That helps people shift from blaming old age for setbacks to identifying specific controllable factors. Like instead of, I failed because I'm old, it's, I failed because I didn't prepare this specific way.
Shifting the explanation.
Right. But there's an important nuance here. Some research shows that standard mindfulness interventions, if not tailored properly, can actually increase internalized ageism in some older adults.
Really? How?
It seems that without the right tools to process the difficult emotions that might come up around aging, simply becoming more aware could potentially reinforce negative feelings for some. It highlights the need for specialized therapeutic approaches.
So tailored approaches are key.
Very key. And a holistic, integrated approach is best coordinating mental, physical, and social health support. And for people who face direct discrimination, therapy focused on that trauma can help them heal, rebuild their sense of agency, and reinforce their self-worth.
Okay, so education, intergenerational contact, therapy. What about the bigger picture, the systemic stuff?
That's the third crucial leg: policy, advocacy, and community initiatives. This is a major focus for the WHO's Decade of Healthy Aging, running from 2021 to 2030.
What kind of policies?
Things like stronger anti-discrimination laws for employment and healthcare, mandating the inclusion of older adults in clinical trials unless there's a strong scientific reason not to,
Makes sense.
and creating age-friendly communities. Think accessible public transport, inclusive public spaces, more opportunities for volunteering and leadership roles for older people. These things combat social isolation directly.
Building connection.
Yes. And advocacy groups are vital for changing the narrative around aging, highlighting contributions, positive aspects, challenging those negative stereotypes in the media and public discourse. Research suggests changing these public narratives really can shift individual beliefs over time.
So it all works together. Individual, community, policy.
Exactly. It needs to be a multi-level approach. Each level reinforces the others. That's where we see the biggest synergistic impact.
That's a powerful and hopeful outlook. It feels like there are concrete things we can do, but when we talk about systemic change, policy change,
Mm.
what's maybe the single biggest barrier to actually implementing these solutions? What are we really up against?
That's a tough one. I think often the biggest barrier is, frankly, a lack of broad public awareness and consequently political will. Ageism is just so normalized, so baked into how we think sometimes.
That it doesn't get seen as seriously as other isms.
Precisely. It often isn't viewed with the same urgency or seriousness as racism or sexism, even though its impacts are demonstrably huge. So really building that collective understanding, showing policymakers the tangible economic and social benefits of combating ageism, that's critical to generating the will to act.
Right, making the invisible visible and showing why it matters to everyone.
Exactly.
Okay. So, looking at the bigger picture then, ageism is clearly a profound public health issue. It hits our mental health, our physical health, our daily lives in really measurable ways. But as we've explored, and this is the hopeful part, it is absolutely not inevitable.
Not at all.
The research demonstrates a clear path forward through this multi-pronged approach: education, connection, therapy, policy, to actually dismantle it.
That's right. It's really about creating a society where everyone, truly everyone at every age, is valued and has the opportunity to thrive. And that takes both building individual resilience and driving that systemic change.
And for listeners who might be grappling with the mental health effects of ageism right now, or maybe other challenges impacting their well-being.
Well, it's so important to remember that specialized support is available. And on that note, Edward Jenny and Associates offers psychotherapy and collaborative assessment specifically designed to help you get to the root of issues faster.
How does that work?
Their approach helps you gain insight into behavioral triggers, develop a much deeper understanding of yourself. They have caring, experienced experts who really prioritize building that strong, understanding relationship with you. And all the research shows that therapeutic relationship is the single most important factor for success in therapy.
So that connection is key.
Absolutely.
Yeah.
So whether you're dealing with depression, anxiety, maybe specifically looking to build resilience against those negative self-perceptions linked to ageism or other issues entirely, their collaborative, science-grounded approach can really help you see your best future more clearly.
That sounds like a really valuable resource. How can people find out more?
You can learn more and request a free consultation by visiting their website, or you can call them directly at 610-444-6089.
Okay, great. We'll make sure that info is available.
Yeah.
Now, as we wrap up, knowing what you now know about how pervasive ageism is, how deeply it impacts us, here's something to think about.
Yeah.
How will you personally challenge ageist beliefs? Both the ones maybe lingering in your own mind and the ones you see out in the world around you. How can you help foster a future where age truly is just a number, celebrated for the wisdom and the unique experiences it brings?